Did you know your waistline could be a silent predictor of serious health issues like heart disease and diabetes? It's not just about how you look, it's about what's happening inside. A groundbreaking yet simple home test, dubbed the string test, is gaining traction as a powerful tool to assess your metabolic health. Popularized by Dr. Claire Bailey Mosley and her son Dr. Jack Mosley in a viral Instagram video, this method uses nothing more than a piece of string to uncover hidden risks that traditional scales might miss. But here's where it gets controversial. Could something as basic as a string really outshine complex medical tools in predicting your health risks? Let's dive in. Why the string test matters. The string test zeroes in on central fat, the type that accumulates around your abdomen. Unlike subcutaneous fat, visceral fat is a red flag for cardiometabolic risks, including insulin resistance, heart attacks, strokes, and metabolic syndrome. While BMI focuses solely on weight and height, this test targets the fat that poses the greatest threat to your heart and metabolic health. And this is the part most people miss. It's not just about being overweight, it's about where the fat is stored. How to perform the string test at home. Ready to give it a try? Here's how. 1. Grab a piece of string, any will do. 2. Measure your full height with the string. 3. Fold the string in half. 4. Wrap it around your waist at belly button level. If the ends meet without overlapping, you're in a healthy range. If they don't, it's a sign to take action. Understanding your results. Ends meet comfortably, your waist-to-height ratio is within a healthy range. Ends don't meet, this suggests a higher risk of cardiometabolic issues, signaling it's time to re-evaluate your lifestyle. Think of this test as your personal early warning system, a simple way to catch potential health problems before they escalate. The science behind the string test. The string test is essentially a practical way to estimate your waist-to-height ratio, a metric increasingly recognized for its accuracy in predicting cardiometabolic health. Here's the proof. A meta-analysis of 31 studies found that waist-to-height ratio outperforms BMI in predicting cardiometabolic risk. Large-scale studies show that individuals with a higher waist-to-height ratio face significantly greater risks of heart attacks and strokes. A North Indian cohort study revealed that this ratio, combined with waist circumference, is more effective than BMI or waist-to-hip ratio in predicting hypertension and metabolic complications. These findings highlight the string test's relevance across diverse populations and body types, making it a universally accessible tool. What to do if your string test shows risk? Failing the test doesn't mean you're doomed, but it's a wake-up call. Here's how to take control. 1. Move more. Aim for 150 to 300 minutes of moderate intensity exercise weekly. Activities like walking, cycling, or swimming target visceral fat and improve insulin sensitivity. 2. Eat smarter. Focus on whole grains, fruits, vegetables, lean proteins, and healthy fats. Cutting back on processed foods and sugars is crucial for metabolic health. 3. Lose weight gradually. Even a 5 to 10% reduction in body weight can significantly lower cardiometabolic risk, especially for those with central obesity. 4. Manage stress and sleep. Chronic stress and poor sleep contribute to visceral fat. Incorporate mindfulness, meditation, and aim for 7 to 9 hours of sleep nightly. 5. Monitor regularly. Keep an eye on blood pressure, fasting glucose, HbA1c, and lipid profiles to catch metabolic issues early. Why the string test works? The beauty of the string test lies in its simplicity and accessibility. It's a science-backed, cost-free tool that empowers you to take charge of your health from home. Research consistently shows that lifestyle changes targeting central obesity can dramatically reduce cardiometabolic risks. By using this test, you're not just measuring your waist, you're taking the first step toward a healthier heart and metabolism. But here's the question, In an age of advanced medical technology, is a piece of string really enough to assess our health? Or are we overlooking its potential? Share your thoughts in the comments, let's spark a conversation. Disclaimer: this article is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor for personalized health guidance.